There are many days when my grandmother doesn't take her medication correctly, messes up her blood work, or skips both altogether. She grew up in a small village in India and doesn't speak English. She also struggles to read Telugu, her native language. She has high blood pressure, diabetes, and anxiety, and every day she needs to take several medications, get regular blood work, and monitor sugar levels with continuous glucose monitor on her arm. Growing up, she relied on Ayurvedic remedies, and modern medicine still feels overwhelming to her.
All her prescriptions and instructions are printed in long blocks of English text. Last week, she was diagnosed with a hernia and needed surgery. When the doctor explained the procedure, she had a translator, but even in Telugu, phrases like cutting a slit in your stomach mixed with scientific terminology terrified her. Even when language barriers are addressed, understanding is not always there. My grandmother is not alone. This is a struggle faced by elderly patients, children, and many others who are in between. Modern medicine often forgets that communication goes beyond words. Some people, like my grandmother, are visual learners.
This is where MediMoji comes in, a software built to bridge language barriers and understanding in medicine. This is done through 3 key features: live translation and reports, interactive pain map, and the AI visual education. This is the workflow for MediMoji, where essentially the patient comes in and how the physician uses the software in order to provide the necessary results for the patient. There's 3 key places that MediMoji can be used: pediatric and geriatric hospitals, safety net hospitals, and community health clinics. And this is our tech stack.
First feature that we have is essentially a voice translation that would be used between the doctor and the patient for back and forth conversation. Once the details are filled out, the doctor and the patient can now go into this voice translation session where they can choose a source language and target language in order to have this back and forth conversation between both of these recipients. This is just a workflow of how this conversation will look between the doctor and the patient. So first, the doctor will ask the question,
What pain are you currently feeling?
which will then get translated to,
¿Qué dolor sientes actualmente?
and so if the patient responds,
Siento dolor en mis pies.
this gets translated to for the doctor,
I feel pain in my feet.
So after the patient has adequately communicated with the medical assistant, we want to get more information for a possible diagnosis for the patient, specifically for nonverbal patients that have a trouble explaining the whereabouts or type of pain that they're feeling. At this, we implemented 3D modeling software to pinpoint exactly where and when the patient is feeling pain. So for example, if the patient here is feeling pain in their right foot, I can say dull and aching, and then I can place the pinpoints here. And from this, we get possible next steps for the patient, as well as the possible conditions. So we have diabetic neuropathy.
And finally, our illustrations feature allows doctors to help create personalized diagrams and comic strips designed to help explain complex medical processes in a digestible manner. For example, let's go ahead and test this. And as you can see, the model ends up outputting a comic-based approach